Hello everyone, welcome back to my channel, The Theoretical Doctor Audio Blogs. In this video, I'll be sharing my experience working my first night shift in General Paediatrics, Paeds 2B during my third posting in my Housemanship Journey. The link to the article of this audio blog is available in the description below if you would prefer to read on it instead. My first on-night shift or night shift in General Paediatrics or just within the Pediatrics department was in the General Paediatrics Ward 2B. It was 3 days prior to me flying home, and I was looking forward to it. Besides, after having just off tag, I was due to go on a night shift with my mentor. I arrived at the ward at 6 p.m. The ward was turning from active to passive. Basically, till 12 midnight, there would be new patients admitting. Upon arriving, I was told that there is a patient who was frequently having frequent hypoglycemic episodes. She was not fasting. The moment her blood sugar profile reached to a certain value, I would need to inform the medical officer and be on standby and to aspirate about 20 ml of blood from a little girl barely 2 to 3 years old because they would run a bunch of tests. Apparently, the moment the blood was taken, we had to serve her a glucose drink and allow her to eat before she starts seizing. That scared me. I proceeded to continue my review for the acute bay patients as well as clerking any new cases and taking bloods. Around 8 p.m., my mentor came in and told me that there were many ongoing cases in the emergency department and she would not be able to follow the on-call rounds. Thankfully, the specialist on-call is a dear and I was comfortable with presenting to her. She eventually came. I presented the cases and proceeded to clerk any new admissions as well as taking their blood. I can't remember the amount of admissions that night, but I do remember it being a rather smooth one. In between, there were patients who developed fever, to which I asked the staff nurse to serve paracetamol after calculating the dosage and according to their weight and indenting it. Looking back, how easily I would prescribe paracetamol upon a child having fever and assessing if the situation warrants for blood taking. But then, I was nervous and terrified. The night progressed and around 3 a.m. the staff nurse informed me that the hypoglycemic child's blood sugar profile was 3.5. Upon reaching 3, I had to inform the medical officer and stand by to aspirate 20 ml of blood on this poor girl. At 3 a.m. in the morning? No way. Well, she was not asked to fast, and thus correcting it would not be hard. I then asked the nurse and her mother to serve her about 10 cc of carbonated drinks. I felt bad as she was asleep, but I could not risk her being extremely hypoglycemic. Thus, amidst the crying and shouting to go back to sleep, we woke her up and eventually she started eating. Obviously, her blood sugar profile increased at least to a safe range, whereby if anything were to occur, it would be during the morning shift and there were more people around to help out. I proceeded to go to Paediatric 4A at level 4 to take the coming mornings of the NNJ or neonatal jaundice babies. After taking the bloods, I proceeded to send them and return to the ward to trace the coming morning blood sent. At around 6 to 7 a.m., the morning house officers will start to arrive for their morning reviews. That is when things started to tone down and it would be safe to leave the ward. I proceeded with brushing my teeth, changing my clothes and went to the pantry to have my morning coffee while awaiting the morning team to summon me in the group to help out with the morning job list. The referrals were many SIR tests in which I have to poke the nostrils of the patient similar to a COVID-19 test and wrap it in a 3-layer packaging to be sent to the molecular lab. Basically, the first night went by extremely well in General Paediatrics and I was done an hour prior to 10 a.m. and went back on time that day. The best thing about ending that shift is that I was looking forward to my applied leave as I would be flying back to my hometown for 5 days, which turned out to be the best weekend I ever had in the longest time. Thank you for listening to this audio blog. Do stay tuned for more, which will be available every Wednesdays, Thursdays, and Fridays. Remember to click on the subscribe button as well as the bell button so you won't miss out on any upcoming audio blogs.